Good afternoon. I'm Bill Bellinger, Chair of the Baylor Religion Department, and it is my privilege to welcome you to this early session in the conference. And thank you for moving down the hall. I think everyone will be comfortable and have space to be here, and that's a good thing. Our topic in this session is responsibility in the global health crisis, and we are glad to have Professor Elias Bongmba from Rice University with us for the session. Professor Bongmba is the Harry and Hazel Chavon Chair in Christian Theology and Professor of Religious Studies at Rice. His scholarly interests include African religions, as well as research in theology and philosophy of religion that combines both African philosophical studies and ideas and continental philosophy. His third book was published in 2007, entitled Facing a Pandemic: The African Church and the Crisis of AIDS. In it, he addresses the HIV/AIDS crisis and argues that the image of God challenges religious communities in Africa to participate in the fight against HIV/AIDS at the local and national levels through an ethic of love and compassion. He was telling me earlier today that he has just been elected the incoming president of the African Association for the Study of Religion. So we very much look forward to his presentation this afternoon entitled Restoring Human Dignity, Responsibility in Healthcare, and we will have time for discussion after his presentation. So Professor Bongmba, welcome.
Thank you so much, Dr. Bellinger, for that warm welcome. Thank you also for what all of you have done. As somebody who works in religious studies, it is always refreshing to get in touch with a community where faith issues and scholarly issues are brought together, and I am very pleased to be here this afternoon. I also wanted to thank Dr. Darren Davis, the director of the Institute, Dr. Jason Witt, Rosemary Fritz, and Vicky Schultz, who have sent all the emails and made all the contacts to make it possible for me to participate in this conference. Thank you very much. There's no doubt in my mind, and I think for many of you, that the recent healthcare debates in the United States has highlighted something which all of us can talk about, even though we may disagree on all of the issues that have been raised by that debate and even the legislation that was passed into law and signed by President Barack Obama. I think central to that one thing which we may all agree is important is the issue of human dignity. For a long time, philosophers have talked about the idea of death, what it means, how to respond to it, but I think they have not succeeded in taking away that concern for that which is human and the dignity which the human individual, each individual or a community has. Now, whether you think of death in a very individualized way or illness in a very individualized way, there is still something that we all share together, and that's the fact that we face enormous challenges when it comes to the restoration of human dignity. Why do we use the word restored, whatever happened to it? I think we use the word restored because we know that some of the practices that we have engaged in have contributed to the abuse of that dignity or the maltreatment or the neglect in some cases of that dignity. And so it is incumbent, especially to people of faith or people of the scholarly community, to rethink what those possibilities are that we could engage in and restore that dignity. I work in the area of African studies, and for me, restoring that dignity brings to the forefront one of the greatest crises that the continent has ever faced, and this is the crisis of HIV and AIDS. It's not only an African problem, it is a global problem. And it's a global problem that needs to be considered seriously. And I think my concern, and I shared this at this conference, is that we have reached a place where nearly 30 years after the first scholarly report from the Centers for Disease Control was issued on HIV and AIDS, we have come to a point where we are beginning to normalize, if I use that word advisedly, normalize the crisis that we have in HIV and AIDS. And so, we can boast we have 5 million people in the world today on antiretroviral drugs. That is out of a possibility of 30 million people living with the disease. And so we then can begin also to talk about donor fatigue. We can begin to talk about the fact that the politicians will tell us we have more other things that are very important that we need to attend to, and we cannot really talk about HIV and AIDS. That's not the only thing. The old saying, which many politicians said in Africa, look, malaria is our biggest killer, and we are figuring out what to do about it. HIV and AIDS is not as bad as it thinks. So that sense of normalcy, that sense of feeling at home with a crisis that has not been resolved, I think is what is frightening to most people. Not only frightening because the virus continues to spread, it is frightening because the individuals affected, either as the one infected with the virus or members of the family who have to provide long-term care, really go through a long period of suffering. It is a long period of suffering during which the human dignity is severely compromised and curtailed. And so it is incumbent then for us to talk about the possibility of rethinking, restoring this dignity that is being swept and wiped away by this virus, and making us turn and look at the human individual as a person who should receive attention. Responsibility refers to different things. If I'm a politician, I may stand up after a major disaster and say, I take responsibility for everything. That may help me in elections. But I don't think I am saying something that has depth to it, as a philosopher would think of when they talk of responsibility. If I had a major company, I may say, I'm going to take responsibility for everything. We will make sure we do everything right. It still may not carry the meaning or the significance which either a philosopher, a theologian, or a faith leader might bring to the table when they talk about the idea of responsibility. And the questions then one raises about responsibility are usually, what does it mean? To take responsibility for an action, does that mean one is legally liable for that thing? To say, we are responsible for this, does that mean we own it and we can keep it from other people? There are a number of questions that deal with that. To use a scriptural metaphor, when somebody says, I am responsible, can we go back to the old mythic accounts, the accounts of the Bible, and say, Cain was wrong, he was his brother's keeper, or I am responsible, therefore I am my sister's keeper, or I am responsible, therefore I am my son or daughter's keeper. These are all questions that come when we talk about responsibility. And so restoring human dignity then invites us to think critically on the idea of responsibility. H.M. Callen has argued a theory of responsibility, like any other theory, is a reflection of the social situation which generates the theory. Its metrics is some immediate relationship of human beings as individuals and as societies to one another. Responsibility is a function of their contact, of their harmonies and conflict. Whose continual adjustments and readjustments compose the processes of social life. I take that definition seriously because when we therefore talk about responsibility, we are talking about the daily interactions, the engagements, the contracts that we have with people. I mean, except today we would say that that responsibility does not only relate to other human beings, we would say it relates to our environment, our engagement with the environment, to animals, to all species that we interact with in life. And so that idea of responsibility then continues to shape, at least from my perspective, what one ought to mean when one says, I am responsible for this. In all cases, when we look at responsibility, one can go back and raise the question, what did it always imply, even with the Greek philosophers, when one talked about responsibility? There was always something, if not directly present, or if not placed on the table as an argument directly, that implied that responsibility involved moral virtue. So the Greek philosophers included certain excellences which would guide human beings as members of a political community to live and function well. During the Roman times, those were considered traits which were acquired by strong members of the society. At the time of St. Thomas Aquinas, those qualities and traits and so forth were infused or interpreted through the lens of theological virtues. I have come to appreciate the distinctions made by J.R. Lucas, who has argued that the word responsible might just be the best English rendition of the phrase from Aristotle, which was called phronimos. And Lucas argues the term refers to an all-round reasonableness and reliability, not confined to any particular topic, and entering into the most other desirable qualities of character. And so today then, when we want to think about restoring human dignity, I think a place where one ought to start would be to review what our obligations are, or in other words, what our responsibilities are. This afternoon, I want to focus on responsibility in part of two groups, large groups, and then make maybe very broad remarks about that, which will open room for a conversation. Now, whether we think of these ideas of responsibility on a large scale or on a small scale, we are then talking about what one can do, not only because of their subjective conditions, but one can do when they expand their ideas, their reasonable actions to involve those who surround that individual. It is not always easy to assign responsibility to someone, and we can give several examples. We all know about the debate about the Nazi Holocaust. Was Germany responsible? More recently, the debate has been raised about the Holocaust in Rwanda, where all the Hutu people in Uganda are responsible for that Holocaust. We can talk about the ongoing crisis in the Darfur region of Sudan. Are all of those people responsible, or is it President Omar Bashir alone who has been indicted by the International Court of Justice who should take responsibility? I happen to think that there are times indeed when human dignity has been compromised to such an extent that we have seen in some of these cases, and we continue to see on a daily basis. There is a sense in which one could argue that a group of people or a community or those in power who are making the decisions should be held accountable. They are responsible for what has happened. And so if we elaborate responsibility then, we want to say, yes, individuals are responsible for their actions. Communities can be held responsible for their action, even to the extent that we may want to assign not only blame, but legal responsibility for that. And when it comes to larger global issues like we face now, take for instance HIV and AIDS, the question then becomes, what do we mean by responsibility? I think I'm speaking largely in terms of political responsibility. I'm talking of ecclesial responsibility in these two cases. If you go back to the debates of the late 1970s, especially following the Lagos Plan of Action taken by the former Organization of African Unity, now the African Union, you will see that the African leaders pledged themselves to do certain things in order to restore their economies and reform political life and political discourse on the continent. In fact, the Lagos Plan of Action was actually probably a very bold plan that could have worked. But because they decided to keep government as a major player in the economies of the region, the World Bank stepped in and introduced, through a research and work done by Elliot Byrd, a commission he headed, what would later become the Structural Adjustment Plan. Now, why do I refer to this? I refer to this because it seems to me that sometimes during that discussion and transition from the Lagos Plan of Action, which was actually a wonderful, reasonably thought out document by African leaders, to the commission report issued by Elliot Byrd, and then its implementation in what was called the Structural Adjustment Program, somehow many leaders in Africa dropped the ball. They dropped the ball by first attacking the plan as one that has been imposed by the World Bank and its affiliate, his sister organization, the International Monetary Fund. But they also dropped the ball in taking a strong stand, saying, look, this new report accuses us. We are not responsible for what has happened financially. And the result was that what appeared to be a new movement towards democracy was stifled. And as these debates were going on, by 1981, HIV/AIDS became a major issue, and then these leaders run away from their responsibility by saying, no, this is not our problem. It is a gay disease. And in fact, many of them joked something is going to come from America and kill everybody. But as the spread continued, it soon became very clear, at least in my community, that this was not a gay disease. This was a very human problem that needed to be tackled. Now, many of the leaders pushed their responsibility aside. They did not include it in the planning. They did not set up education committees. Even where they set up education committees, these committees were not funded in order to carry the mandate. The long story is that the shirking of this kind of responsibility then made it a situation that was already very bad, very bad indeed. Now, I go back to this because if responsibility is important, then we have to raise questions about governance. What does it mean to govern? Is there a way of governing responsibly? Is there a way of tackling issues in such a systematic, reasoned way that responds not only to the crisis members of the community face, but comes up with innovative ideas that can change those situations? I think my proposition is that African leaders have always been capable of that. In terms of resources, they are. I think a country like Nigeria is a sleeping giant that will one day wake up. If I have any magic, I would wake it up. But there's a lot of potential, a lot of resources that could be brought to table to harness. And what hinders this, I think, is the problem of governance. And so during the 80s, there was this long debate about what it means to govern. Many people talk of governance as if it was just simply setting rules, carrying out regulations, setting up regulatory systems in order to follow what goes on in the state. Instead, I think what was missed during this discussion was the fact that governance is first and foremost a science that has its own principles, a science that can be discussed, analyzed, and looked at from different perspectives, that propositions can actually be tested to see if they work. But more than that, governance is also an art. As an art, it invites those who have been given the responsibility, or those who govern responsibly, the opportunity not only to think, but the opportunity to reflect, to establish, to build visions which will then allow them to move forward and be creative in responding to the crisis the community faces in different ways. And I think it is this sort of, this lack of responsibility in seeing governance not really as carrying out rules, but being creative, being visionary, acting in such a way that the motivation of the people would be brought together in order to examine the issues that each society faces that became a big problem for many of the leaders. And when you look at governance that way, then governance becomes not a power scheme or a structural problem. Governance then becomes a relational thing. It's a relational thing because one relates to members of the political community that that person has been given the obligation to lead or the responsibility to lead. Governance is a relation because we are not only pushing papers and creating files, we are dealing with the very things that involve people on a daily basis. Governance then becomes a vision because when laws and legislations are enacted, they all come from the creative mind of someone who has thought out an idea which then can go through the parliamentary process and become a law that would be very helpful to people. And so as long as leaders take off their eyes from that and make governance only the practice of carrying out presidential decrees like it is in Cameroon, then when we face a crisis, everybody is not carrying his or her responsibility. Everybody is not paying attention to what they need to do. And so then the question then becomes, on what grounds do we make such an argument? I think there are three possibilities. Let's start with the African context. Scholars in the African context, particularly in the Southern African region, have argued very vigorously that governance, social interaction, or being responsible for anything, being responsible for someone, involves the application of a theory they have been calling Ubuntu, which really broadly defined just means humanity, caring for one another, extending compassion, and so forth. So the term Ubuntu then broadly defines that community. It is a complex term which brings together different perspectives on the good life, happiness for individuals as well as all the members of a political community. It involves understanding individual and social obligations in the political community. But the problem always is that when many people talk about Ubuntu, it is always for them a communal ethic. It is always a communal ethic. I think the mistake is when we make it only a communal ethic, we lose out on some of the dimensions of the idea of Ubuntu. I think embedded in that idea of Ubuntu is an aspect of individual life, which may be embedded in a social context, but which allows an individual to think through issues, bring to the table a reasonable contribution following an analysis of whatever they are thinking about, and then being seen as an individual and being allowed to contribute as a member of the community as individuals. Now, this is a distinction that probably sometimes doesn't work, maybe say in the American context where people are talking about communitarians, people like Stanley Hauerwas, and those who are on the other side of individuals. I think the debate here is a little bit more than that. Within the American context, that debate is carried on in a society that is already assumed is an open society, where there are constitutional provisions or social provisions or legal precedents that first define the importance of what it means to be an individual. And if we then bring together what happens in the context of Ubuntu, largely to say that this is a communitarian ethic, or we can compare it to what somebody like Stanley Hauerwas writes about in his research, I think we are making a mistake. The argument here simply then is, if we are going to begin to talk about responsibility, which invites good governance or best practices, and we are going to ground it on an ethical principle that is called Ubuntu, then we are looking at a process that invites people to take individuals seriously and take the communities seriously. It is not an either or something that one can run away. So Ubuntu then prioritizes the person, does open the door for that individual to contribute to the community, and thus invite that individual to be part of the common search or the search for the common good in the society. And if we look at political practices today, not only on the continent, but in some places around the world, we see that there's a need to begin to cultivate this kind of an ethic, because we need to look after each other. We are each other's bearer. We are responsible for each other. And that responsibility is not only limited to small social gatherings. And the argument I'm making here is that actually, in terms of national policy and governance and good practices, looking after each other is what actually determines if one is carrying their responsibility as a leader. There are a number of things that we can say about Ubuntu, but let me just leave it like that. I think we have made the point. The other philosophical perspective that at least underscores the idea of responsibility, especially on the part of those who govern, comes from the work of Emmanuel Levinas. Levinas, over the years, articulated the idea of a very distinct other who could not be subsumed or oppressed or controlled by the subject. Unfortunately, he didn't really write very much about politics. But if we go through everything he has said or articulated, I think it becomes clear that governance is a relation. If it is a relation, then we can make a case for governing in such a way that one would respect the other and treat the other as a superior, not only as members of the political community who are either lazy, looking for handouts, or who cannot properly fulfill their functions, or who must be lorded over in places where some people think that they have the right to govern. And so Levinas's ethics then would invite us to prioritize the other. And in that prioritization of the other, we are able to open a window, open a space for a genuine dialogue to begin between the other and those who are in power. But a third point, and then I will move on. I think when we talk about governing with responsibility from an ethical perspective, the work of Amartya Sen over the years has introduced new ideas. I mean, he's very well known for talking about the ideas of developing human capabilities. But I think one of the most far-reaching ideas that he has placed on the table is to look at the idea of development as freedom. Development as freedom for him invites those who govern to create a context, a situation in which members of the political community will feel free, liberated, at least to contribute to the discussion about life in the community. Members of the community would not be inhibited from bringing to the table what they think should be done. And I raise this because coming from a Nobel winning economist, it seems as Sen has moved into the soft side of economics, where he ought to be crunching numbers and looking at statistics, consulting his math books before making the various distinctions. But I think he has laid his hand on a very important issue, and that is the fact that the art of governance, the art and practice of politics involves the expansion of spaces, ideas that would create free spaces for individuals to be able to contribute to the building of society. Otherwise, I mean, how could we develop human capability if the individuals for whom we are working or developing this dialogue on human capabilities are not free or do not have the agency, or I mean, they do have the agency, but are not given room to express that kind of freedom. So development, therefore, under this new rubric means we are not only talking about infrastructure. We are not only talking about roads. We are not only talking about telephone and telephone lines. In fact, it might not even mean, ironically as it might sound, building new hospitals. It means allowing people the space, the freedom to engage in that walk of life which is transformative, which we then call development. I think on the basis of this, we can then begin to make a number of propositions. If human dignity needs to be restored, and the restoration of that human dignity involves very deliberate, thought-out political action, which we say must be done when people accept their responsibility to govern, and that is strengthened by an ethic which allows us to respect individuals and work with members of the political community, and furthermore allows us to see a radical other who stands in front of us face to face, whom we cannot dominate, as Levinas has argued, or invites us to create spaces, like Amartya Sen has argued, spaces of freedom. Then what can we say in terms of the global health crisis that we have now? I think there are two things. One, this comes straightforward from the World Health Organization. After many, many attempts by all the organizations, World Health Organization, World Bank, the Joint United Nations Program to combat HIV and AIDS, and all other things, it has become clear that out of 30-something million people living with HIV and AIDS, only about 5 million people are on some kind of a treatment program. This is a very dismal record. And in order to deal with that, the World Health Organization has proposed that governments return to best practices. Those best practices include returning to basic primary health care. If governments are going to act in a responsible manner to enable their societies restore human dignity, basic primary health care is the way to go. Now, we're not saying stop fighting HIV and AIDS. I think in 1978, when the World Health Organization met at Alma Ata and issued that declaration, Health for All, by the year 2000, which of course by the year 2000, one could have said death for all, the idea behind it was that member states of the World Health Organization were going to carry out basic primary health care, provision of drinking water, provision of latrines, provision of anything that would work to enhance healthcare at a local village. In fact, in many local villages, it doesn't need electricity to do those things. In many local villages, one doesn't have, a two-lane road or a huge infrastructure. And for many people, it might just be something as little as the provision of good drinking water. That can go a long way. So all the basic ingredients of primary health care have now been brought to the table, making it a responsibility of each state. Now, how is this working out? This is probably not working out well. I grew up in Cameroon, where one of the response to this initiative to provide health care for all by the year 2000 was not only to beef up the medical school and improve standards, which they did actually quite well. Our graduates and students from Yaoundé eventually would go specialize in places like University of Lagos, University of Ibadan, and then some would go overseas to specialize. This was a good move. And in many cases, the government would actually announce that they have awarded this district a hospital. Now, here's where the failure lies. When they said we have opened a hospital in a district, they would send a medical officer, probably build one little building with the contractor having schemed nearly half of the money for that contract. And there's the doctor, there's the office, there's the nurse's station, and so forth. That's the hospital. No medications, nothing to do a lot of the lab work that is needed. And so you walk into the government hospital, they will say, oh, we can't do this here. Take the patient to the Baptist Mission Hospital. Take the patient to the Catholic hospital. Sure, all of those investments in infrastructure were intended to carry out, if we might use the word mandate of the World Health Organization, to bring and improve primary health care. But nobody thought through reasonably, rationally, what to do in order to affect that. In fact, if they had followed the basic ideas that were put on the table at Alma Ata, this wouldn't have been so complicated. And I think, why is this important? This is important because if you follow the literature that comes from UNAIDS and other agencies involved and the research that has been done on HIV and AIDS, it soon becomes clear that what UNAIDS calls drivers of HIV/AIDS are a lot of the social, economic, and the cultural problems which people have to sift through, which have not been addressed. And once you address those things, it improves the general health care. And so it is therefore clear that focusing on HIV/AIDS as something which only reflects what some may call a deviant sexuality is not really the answer. I don't think 30-something million Africans live with HIV/AIDS because they are more sexual beings than anyone in the world. I think it is the fact that all of the resources intended to build up primary health care have not been put in place. And it is for that reason that we can then make a case that in attempt to restore human dignity, something as basic as improving primary health care will be the way to go. In fact, there is a lot of technical issues here to address, which is not really possible to address in a talk like this, but Alma Ata invites a return to primary health care. Now, let me turn to a second idea which really comes from religious communities. And I can bring it up here largely because this is a symposium that focuses on faith. For many, many years, following a plan that was tried out in Uganda, the African leaders and the Christian leaders in Africa agreed that they would come up with a prevention of HIV strategy that would involve what was called ABC. 1, abstain from sexual intercourse. Number 2, be faithful if you are married, or be faithful to your partner. If you cannot do those 2, number 3, you use a condom. Condom was a huge compromise for the African leaders. In fact, even Yoweri Museveni, who was the poster boy of good governance in those days, I mean, that has changed now, that's why I say that, he went along, only to step back again later on, arguing that there are many people in the West who are trying to condomize Africa. And then he went on to talk about the fact that condoms don't work most of the time, and it's not good to force people on this. I mean, I wouldn't bring this. I mean, I have addressed this elsewhere. But what made me return to this debate was a year ago, Pope Benedict XVI went on his first maiden trip to Africa. And he started it in Cameroon. But before his plane landed, he gave a news conference in which he lashed out at those who are promoting the use of condoms in fighting HIV and AIDS. You know, it's mind-boggling to think that religious leaders still think that way. Here is the question, and again, I have talked about this extensively elsewhere. What is a condom? A simple mechanical device that has been made to prevent fluids from going from a man's body into a woman's body. That is it. Do we need to fetishize it any more than what it is? I don't think so. But for some reason, most of the clergy in Africa actually think that condoms are a bad thing. This is not a joke. Last July, I participated in a summer school at Makerere University Teaching Hospital. We had invited all of the stakeholders in religion in Uganda who are doing something about HIV and AIDS to come and talk to us. So we sat quietly and every one of them spoke for about an hour. Then when the discussion turned to prevention methods and the whole idea of condoms was mentioned, they all got so defensive. So defensive. It was really, we couldn't understand where this was coming from. We appealed to them. We said, look, nobody is imposing this on Africans. If Africans or your people want to have sex, then it is better that they have sex and stay alive. And so why don't you think in terms of life and human dignity first? They said, well, we think abstinence is the best. Oh, sure, abstinence is the safest thing. You don't want to have a problem? Don't have sex at all. Nobody argues with that. In fact, even public health officials have said that for a long time. But if you cannot, why not use a condom? Apparently, for all of those religious leaders on the table, except one, Canon Biumungisa, the first clergy person to have declared that he was living with HIV, supported it. In fact, he sort of put it in a joking way. He said, in our community, if it is not on, it is not in. You know, everybody laughed about it, but that was the truth. What does responsible leadership call in this type of circumstances? Here's what I think. I think African leaders ought to meet with religious leaders and say, look, we appreciate what you are doing. Because in many cases, the only viable hospitals in Africa are religious hospitals and institutions. A recent study done jointly by the University of Cape Town and Witwatersrand has demonstrated that in many countries in Africa, up to about, anywhere between 30 and 70% of all the healthcare is provided by religious communities. And so if religious communities do that much good, I think it is the responsibility of political leaders to sit down with them and say, we appreciate this, but also help us do our work better. Don't always lash out at condoms. Don't always discourage condoms or preach against it from the pulpit, because that shows that we are not carrying our responsibility in protecting possible future infections. But I also think that there's something that can be done. We all are familiar with the story of vaccinations in northern Nigeria, where certain Muslim families did not want to get that vaccination. No, that is not the end of the story. Recently, I think this year, as a matter of fact, in Botswana, a certain African-initiated church has refused that their children cannot be vaccinated. I think it was against whooping cough. And it became such a big standoff with the government leaders until the government threatened actually to jail any parent who refused that vaccination. Now, my question here is, in a situation where healthcare is a major crisis, can one compare refusing to take medical products or put it on the same level with something like conscientious objection? I would argue no. I think there is a time when an individual can say, look, I cannot bear arms and fight. But when it comes to protecting the health of a community at a time when there is an epidemic going, I think the state has a right to negotiate as vigorously as they can with religious leaders to help maybe educate or to help them know that the position they hold is wrong. By the time the whole thing was over, the president of Botswana was vowing that these people are misguided and they are misleading people, they are vicious and all of that. But I think this is not the end of the story. There are many, many, many religious communities in Africa that do indeed believe that if one is ill, all that needs to happen is that members of the religious community should pray for them, put their hands on them, heal them. But I think, with all due respect to many of these leaders, if we are facing a global crisis on some very difficult health issues, it would be an act of responsibility for the leaders of a particular political community to get into dialogue with the religious leaders. It doesn't really matter how long it takes, because if they don't do that, I think many, many, many children will not get vaccinated, and there's the risk that all of what they are fighting against or all what they have worked would be lost because the state has failed to take this action. Now, this is not an easy thing. This is not an easy thing. As you know, I mean, you all know, particularly in this community, that it's always very difficult for politicians to work with religious groups. Sometimes politicians are so easy to pull the trigger or to mount a massive blockade and shout and shout and shout and shout, hoping that that shouting will break the individual. Of course, I'm referring to the Courage incident here. But it's incumbent on political leaders that they are in touch with religious leaders, not to hinder them from the work they are doing, but to work with them in a way that will prioritize public health and not compromise it when it comes to medication. I think the next several years will be determining years in Africa, certainly around the world. The rates of HIV infections have gone down considerably. To be fair to most African governments, many countries are now providing free antiretroviral drugs to members of their community. But there's a lot that needs to be done. I think the physicians and the healthcare experts can speak about this better. From my perspective, I think we can restore human dignity. And the way to restore human dignity would be to articulate responsibility that has meaning, responsibility which in some cases may actually make someone legally liable for what they have done or what they have not done, and responsibility which would lead to good governance and good practices. Why? Because the African ethic itself calls for that through Ubuntu, and the idea of a radical other who invites us in a dialogue, an enabling dialogue which will enable each other contribute meaningfully to community relations, and then the whole idea that development is freedom. There are different avenues, different things in which this can be demonstrated, but I have used the example of the need to return and develop primary health care, as well as engage the religious leaders in things that might not actually cost the state, but which could go a long way in preventing new infections. Thank you, and I look forward to a discussion.
Thank you very much. I'll field questions and try to repeat them, and then we'll look forward to that.
Thank you very much. I appreciate very much what you said about primary care. I think it's extremely important. Let me say, I am not an ethicist, not a philosopher, neither an epidemiologist or physician, but I have one question, or perhaps two. One is that it has been said that the condom use gives a sense of false security to the users, and therefore is not necessarily so helpful in preventing the illness. I think it's someone from Harvard by the name of Green that said that the condom can be useful or can be very efficient in certain areas, very constricted areas, in Thailandia or in San Francisco, but not necessarily in places like Africa. That is one question. The second thing is that, as you described the condom only as a mechanical, only a simple mechanical device that should not interfere with human dignity or with the dignity of sexuality, I wonder then why it is also to give importance to abstinence.
So the questioner first expressed appreciation for the emphasis on primary care, but the two questions have to do with condoms. One, the argument that the condom could actually give a sense of false security, and so be helpful in some areas, but not globally, and particularly perhaps not in Africa. And then the second question was, I've now lost. I'm sorry, I don't have.
The second question is, if the condom is only a mechanical
Right.
simple device
Right.
that does not interfere with human dignity, then why give any importance to abstinence?
If the condom is simply a mechanical device that does not interfere with human dignity, then why give significance to abstinence?
Thank you. Those are really good questions. The second one I think I take is very easy. If it is a simple mechanical device, would it destroy abstinence? No. The idea is that someone who comes to the place, at least when it was formulated, the ABC strategy was formulated in Uganda, was that abstinence is the best choice. I see no one who ever disagrees with abstinence. Number two, if you are married or you are not married and you have a sexual partner, be faithful to that partner. If you cannot do these two, then it is incumbent on you to use a condom. That's when these leaders came to that point. I mean, if I were saying something like that, I would not even put it that way. Actually knowing human beings, understanding human sexuality, I probably would just go ahead and put condoms first. The issue in the context in which this debate is taking place is not that people have condoms, then they're going to have sex. The issue is that they are already sexually active and infecting each other. So condoms then is one simple way of preventing it. Does it trump all of the other strategies in prevention? No, it does not. It's simply just basically one of the strategy, which I happen to think actually is probably one of the most important, especially in a case where people are more active. And I think the first question was condoms work in different settings, but not in other settings. And the idea that it has been fetishized is my idea, and I think that I say it has been fetishized simply because, yeah, we have different bodies, but when it comes to places where condoms are placed, it's enough variety. If it works here, it can work in Africa. If it works here, it can work in India. I don't see why people say that. I think an argument can be made about cultural or religious perspectives, but the real question then becomes, if one goes back to religious perspective, then one has to raise the argument in terms of natural law, natural order, and so on and so forth. Or in Africa also, where sexuality is also valued as a mood of procreation. But the truth is, when you are in a war, and I think HIV and AIDS is a real war, you take certain measures to protect. You may go back to the way things were after that is passed, but unfortunately this is not really only an emergency, this is a major issue, so we probably need to talk condoms for a very long time. You know, at this conference in Uganda, the pastor of the largest Pentecostal church in Kampala spoke and actually came down very specific. We felt almost like he was ordering us. And then I asked him, oh, gee, Reverend, do you have to be so magisterial? He laughed, everybody laughed. And I followed it up. I said, look, why is it that as theologians, we cannot come to a point where what theologians have described from the work of Søren Kierkegaard, that you are able to suspend the ethical, or what interpreters of Kierkegaard have called the teleological suspension of morality. He obeyed God to go, Abraham obeyed God to go kill his son. That was a horrible thing, even by Jewish standards in those days. If the command came from God, it still would have been very tough, because that was not what was part of Jewish ethic. But Kierkegaard was willing to do that, hoping that there was some greater good behind it. And so advocating condoms is like, well, yeah, if you think there's a moral virtue to this, well, suspend that morality for a while, because of the possibility it has in saving lives. And finally, I think African leaders often always say condoms don't work half of the time. Well, yeah, if they don't work half of the time, then we would be talking of 15 million people living with HIV and AIDS, not 30.
Thank you. Yes, thank you.
Yeah.
There are two questions. They are more theological in nature. The first one is that there seems to have been a shift from religion in terms of the fear of God to the love of God, and that the fear of God had a great many implications in terms of ethical things, particularly sexuality, in terms of sexuality. And what I suppose the question is, what place does that play in this whole issue that Professor Bongmba is discussing? And the second is that how does corruption relate to particular structures in society that would be a part of this issue?
No, Professor Falola, I agree with you. It's a difficult question. I don't think there's a solution to it. But here is a way some theologians who think as I do would say. One, the idea of fear was preached by religious leaders who wanted to use fear to bring people into the religious community. Sometimes in our denomination, the Baptist tradition, we often talk of fire and brimstone preachers. But people who think as I do also say the sacred texts that those of us in that tradition have inherited have also made it very clear in different places that if one were to take a fundamental characteristic of who God is, that would be love. Now, does that mean, like Paul asked in several of his epistles, one of his epistles, that it is okay to go and do something wrong so that the grace of God may be applicable? No. And so it comes back to, what some might say, well, the individual exercise his or her free will to do what they do. And the teaching that God is love does not actually compromise the fact that one is to fear. That may not do it. It still leaves the question, it still leaves the question. For instance, not in the same way, but there are statistics that show that Muslim families that tend to be very strict on their children, that the rate of prevalence on HIV and AIDS are much, much, much more lower in those regions. Now, does that mean that that sort of strict attitude is good? Would you replace the relative freedom which the Christian tradition, going back to Luther and other people have argued is what believers have been called into? I do not know. I do not know. But I think your question raises a fundamental issue which is actually lacking in some of the teachings in the context of HIV/AIDS. Because what has happened is that preachers are now preaching about sin, condemning people, damning people. Then people who would have come out and said, I am positive, are afraid to come out and say, I am positive. So one wonders if they preached love, accepted those who have been infected, and worked with them to make them live a positive life, would that have made a difference? I do not know. Yeah, you are right. This is a question that one cannot simply answer. The other one, I think, is at the heart of what is going on in the post-colonial state, or post-neo-colonial state, as I usually call it. And that is the fact that the system is shot with corruption. Is it fair for me to yell at a 17-year-old child and say, you are a sinner, you are doing this, you are doing this, you are doing this? No. But that doesn't mean that there are not enough resources, either in traditional African culture, to prepare that young man so that when they reach that place, they will be able to know what is right. And so when we talk then of the idea of responsibility, I talked about the issue. I mean, I didn't read the paper carefully, but when we talk about and begin to analyze it, what we're really saying is that all of the cultural resources of society and religion can be brought to bear on political practice, which goes on as if nobody cares about anything. And that hoping that when people begin to govern and govern well, they can inspire members of the political community to begin to imitate these best practices. I think it would be a mistake for somebody to take a rule book into Africa and say, I've come to teach you about ethics, I've come to teach you. People know a lot about this. But I think the question then becomes, what does the state do in order to motivate? If you go back, and I think I have made this argument elsewhere, when people like Aristotle talked about the virtues, they talked in the context of a polis, where there was already a settled political community, where everybody did what they were supposed to do, where the leaders of the community played the role of teachers, which then allowed people or gave people, members of the community, the freedom to be able to cultivate all of these virtues. And I think, in effect, what I am arguing is that the dismissal of responsibility by the political community has made it possible for all kinds of things to emerge. The young people in Africa today are considerably different from our generation. And that is because you can't go and tell them this. They'll say, oh, I saw a minister cheating the other day. If a minister has to do that, what do you expect me to do? And I think the emphasis on good governance and best practices may be the way. It will take a long time before that change comes. I mentioned Nigeria. I always tell you guys, if Nigeria improves its corruption, cuts it by 1/4, I'm out of here. I'll go look for a job there and live. Because this is a very dynamic people, a huge, prosperous country. But the leaders have never really given its people the freedom to be who they are. And so what you hear is, you go everywhere, you hear the caricature of Nigerians and this. No, those are not the Nigerians I know. I can tell you some terrible things about some leaders. But if we begin to talk about this and discuss about this openly in forums and even in churches, maybe the hope is that idea of responsibility can stick and people will return to good practices.
Thank you very much for your talk. I really appreciate it. I'm from Canada. I'm a physician by training, but I'm working on advanced degree in bioethics. And I introduced myself in the past to the concept of a movement. And I'm looking at covenants coming from a Reformed Christian tradition, looking at covenants as a replacement or alternative to principles-based ethics. What struck me in your talk, I'd like to hear you on this. Is there a way, particularly among Christians, even beyond non-Christians as well, that the concept of Ubuntu in Africa can find commonality or resonate with the idea of covenants as it's been proposed in Western cultural society? I became interested, not partly because of my own Christian tradition, which emphasizes covenants with covenant, but because of literature that was showing that the concept of covenant was being advocated as a way of improving relationality with the medical practice and within relationships with medicine in general. Is that a point of contact that should be looked at carefully and fostered to try to more globally look at this issue of relationality and maybe bridge this terrible past component?
It's a very brief summary, but to comment on the possible connections between covenant, the notions of covenant, particularly in terms of relationality, with the African notion of Ubuntu.
You know, I've never thought of it that way, but I think it's a very appealing idea. It's a very appealing idea. Except that in this case, I probably would go first with Ubuntu itself, meaning an interpersonal or an intersubjective covenant, which may not be written or spelled out, but something which is understandable, something with African communities have practiced for all of their lives, that we see that as an interpersonal covenant in the same way in which the theological idea of covenant is understood. And if one can make that claim and that argument, which I think one could, then the whole idea then of being responsible or respecting the other becomes some sort of a covenant. I mean, the philosophers I read don't talk of otherness in terms of a covenant, but they talk in terms of just the fact that you are immediately summoned to responsibility in the face of other. You recognize you're a human being only in the face of another person. But the theological idea of covenant, I think, can work. Except that in this case, we would say it's not only a covenant that links one to God, but a covenant that actually opens the door to the next person. And just one more quick remark, and I think that would actually fit with some, Paul is a bad boy of the New Testament. He's always bashed, but if you read through the works of St. Paul, notice the phrase, the command, he says, do this to one another. Do this to one another. Do this to one another. Notice how many times. I think like 30 years ago, one preacher in California wrote a small book on one another, highlighting what Paul says. And I think those things that one can do to one another, to one another, to one another, then become sort of mini covenants which can improve relations. But it's a very bright idea. It's still a wonderful idea. I look forward to reading your paper on that. I mean, especially the pharmaceutical network. I think they have been demonized. They come out looking as the bad guys in all of this debate in global health. But it is possible that responsible partnerships can be formed with them. If you talk with Dr. Klein from Baylor College of Medicine in Houston, he would tell you what he has done in several countries around the world is possible because he has formed these partnerships with pharmaceutical companies. He knows some of their bad practices, and so he doesn't go there criticizing them. He goes there asking the question, what can we do together? And that has worked quite well, actually. Thank you.
Yeah, and you talked about, you mentioned Hawaii, and one of the things that Hawaii is known for is focus on the church as the moral community, the place that has the possibility of transformation, it seems, and it doesn't seem to admire the nation state. And the work seems to be based on the nation state. And I was wondering, in terms of corruption and its influence on teachings relating to AIDS, do you think it is fair to focus on the church as a moral community where transformation may happen rather than the state as that possible moral community? I'm not sure if you're familiar with the work of Emmanuel also.
Yeah. Katangole.
Katangole, and that is the kind of thing that we try to do, to shift from the state to the church. What do you think of that?
The question takes its cue from Stanley Hauerwas and the emphasis on the church as a moral community where transformation is possible, and asking if perhaps the issue of corruption could be dealt with maybe by shifting from, in your paper, the issue of the nation state to the church as a moral community. Would that be helpful?
Thank you. No, not really. Not really. I mean, I like Hauerwas a lot, but I think there are many, many moral communities in the world. The church is one of them. In my work on HIV/AIDS, I have tried to follow what the churches have done, and I'm very thankful for what they have done, at least in my region. If the church were not there, we would be talking of a huge, something that we cannot even explain. However, the church is just one of many, many communities. There are certain things in handling a pandemic like this that has global proportions and implications and so forth that only the nation state can do. And I still believe in the nation state. As bad as it is, as difficult as things are going, I still think that they are the only ones who can negotiate certain bilateral protocols, who can look for money, who can invest, who need to actually budget significantly towards payments of it. There's a part of this paper that analyzes the major donors who are supporting the fight against HIV and AIDS. And if I were to talk about that, I would simply say that the nation state in Africa actually needs to invest more. There are many moral communities, the church one, Islamic communities, then traditional communities, indigenous religious communities. I have always waited for a time when somebody would work on the Yoruba materials and write an ethical theory based on that. We can't ignore the nation state, and I think they need to step up to the responsibility of fighting HIV and AIDS.
Yes.
Okay. Yeah. Okay. Thank you, Dr. Benja. That's a good question. I think that's where the tension lies. Notice my use of the word fetishize, or that the condom has been turned into a fetish. And that is why I describe it as a simple mechanical device that is meant to prevent fluids from going from a man's body into a woman's body. The reason I said that, if I were doing it, I would actually put condoms first, is based on this kind of reasoning. One, if you approach it from the gun laws debate in this country, you will see that one cannot just assume that by owning a gun, I'm going to commit a crime. So the same with condoms. I also think that just because the condoms are there in the market does not mean that somebody is going to engage in sexual activity outside marriage or, acceptable relationships. The reason why I say I will put condom first simply is that with the current rate of infection in many countries, and the HIV virus being something that one does not know one has until the symptoms begin to come up, it might be good to take all measures as part of a larger program of control. And then when I say I will put condoms first, I simply mean that it is such an emergency, such a huge thing in my mind that I would rather say to somebody, look, if you cannot abstain, use a condom. But since I also know that people are engaged in sexual activity without even thinking about it, I might as well, at least from myself, say, use a condom. I think the church has a right to its message. When the Holy Father made that statement, I think I was actually quite shocked with the simple conclusion that condoms don't work, or the portrayal by the church that condoms are sinful or they lead to sin. I don't think that there is any study out there that makes that simple correlation which religious leaders try to make. You mentioned Green. I can't think of Green's first name. He actually is probably the one individual who has argued the most that the rates of infection in Uganda fell because of abstinence, not because of condoms. If you read other reports of the district that was very well known, the Rukia district in Uganda, it is also clear that the rates of infection or the figures dropped because of fatalities from AIDS itself. And then the rates dropped because people used more condoms and they were willing to talk about it. The rates dropped thirdly because Museveni actually talked about A, B, C, all three of them. And there is probably enough reason to speculate that President Museveni changed his mind in order to benefit from PEPFAR, the United States President Emergency Fund on HIV/AIDS in Africa, which was launched by President Bush. And the reason he had to take that position was that President Bush had people who were conservative thinkers who then wrote into the plan that PEPFAR money could only be used for abstinence-only programs. And if he needed to access that, it was easy to change his mind. I respect the message of abstinence. I really do. Many people who often criticize Africa don't ever stop to think of the fact that actually the idea of abstinence is very strongly wedded into traditional African culture. In the past, you could be sued for making a young woman pregnant, and the family would go after you. Because from their perspective, when you had sex with a young woman who was not your wife, you spoiled their daughter. Now, one could argue in postmodern language that, well, they were thinking of a woman as a commodity, they're going to get a bride price, blah, 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 and so whatever happens then, that value goes down. But still, there was an ethical element there, which I think the language of abstinence makes a lot of sense. But I also just do think that we are facing a huge problem. If condoms can stop the spread of fluids from one individual to the other, I think that's the moral thing to do. And that's where I actually take a strong difference with the church.
Is there a role for the church in Africa in terms of disciplining the nation state, and particularly leaders who are in the church, who are leaders of the nation state as well, as the church acts as moral?
That is a very difficult question, because I think let's be honest with ourselves. All the church has is the language of persuasion. The church cannot declare war. The church has no jails. The church cannot, they may actually go to jail. That's how Alice Lakwena started in Uganda, the war that would now lead to the Lord's Resistance Army with her uncle, Joseph Kony, still leading that fight. But really, let's be honest. The church has a moral voice, a moral language, and when these conflicts come up, the church speaks a prophetic word, hoping that they will influence the leaders. And they have been trying to do so. It's just that in Africa, it just happens that, or not only Africa, in many parts of the world where people dictate, they have assumed the right that they can do anything. Yes, the Christian community in Africa has an important role to play, and that is going to call on them to use their language of persuasion. It may come to a stage where they may resort to popular protests, because protest movements are dying all over the place. But if they can revive that with a rigorous education and launch strong appeals, and maybe deny some of the leaders communion, maybe things will change. I'm still skeptical, but I hope that can be done.
It's time for us to conclude. Perhaps Professor Bongmba would be willing to talk with you afterwards if you have an additional question or comment, but let's express appreciation to him again.